Thanks for the opportunity to talk to you. I've been on the funding panel for several years now, so hopefully I can provide a bit of insight that is useful to you. I'm just going to kind of walk through the scheme and the program and the two different kind of commissioned and researcher-led schemes and some of the kind of things you might want to think about as you're developing an application. So this funds applied research, so stuff that's going to improve public and patient outcomes, and we fund multiple things, so not just trials. A lot of work that has been funded in the past has been trials, but there's natural experiments, there's all sorts of interesting designs, and I think the key issue is what's the best methodology to answer the question posed. We don't fund discovery science, and we don't fund work involving animals or animal tissue. It funds non-NHS interventions intended to improve the health of the public and reduce inequalities in health. A key thing, which I'll come back to in a few slides, is the scheme does not fund the intervention costs. That's really quite an important point, and I'll pick that up again in a few minutes. It's open to everybody from across the UK, so the devolved nations as well as England. Normally bids include qualitative and quantitative components, and there's a big focus on cost effectiveness and how we can ensure value for money. A key message that I'd like to take away is the primary outcome measure must be health related. So I'll say that again, the primary outcome measure must be health related. So there's two parts to the schemes. There's the researcher-led, where researchers can identify the question and propose the research that they wish to conduct. And then there's also the commission scheme, whereby topics are prioritized centrally by the team based on NICE reviews and evidence synthesis and calls from government for research. And in those situations, there's a kind of call based on the kind of gaps in research, and teams are encouraged to apply. So how does it work? First off, there's a screening process that's done centrally to just check it's within remit. So to make sure that it meets those criteria, that it has a health outcome, that it's a non-NHS program. Then it goes to the prioritization committee, which assesses its public health importance. So these are people, the members of that tends to be directors of public health, people in the third sector, kind of users of research to make sure that the question being asked is of relevance. This isn't the scheme for kind of very ivory towers theoretical research. It needs to have a public health importance. And then once it gets through the prioritization committee, it comes to the funding committee, where our assessment is based on the scientific quality, the feasibility of doing the work, and the value for money. So, key point, I mentioned this earlier, unfortunately the scheme does not fund intervention costs. So if you're developing a new intervention, then you need to look at alternative schemes such as the FIND scheme to develop that. So it's quite a tricky area, and we realize there are challenges of that, but the intervention costs are not funded by the NIHR program. So you have to find an alternative source of funds for those. So that could be a local authority, it could be a national charity, could be some other organization that is willing to fund that element of the program. We do fund some studies that have a developmental component within them, but largely intervention development is funded by the FIND scheme, which you can look at on the UKRI website. So what makes a good idea, a good application? Well, first off, you really need a good idea, and you need to have kind of road tested it with the key stakeholders and really thought about the design. So, as I kind of outlined earlier, we've got the two schemes, and they come in and they are considered by the prioritization committee. And then if you are within competitive and remit checks. You'll then submit the outline or stage 1 application if that cuts to the funding board. If that's considered of sufficient quality, it would move forward to a full proposal. But it is possible that things get rejected there. It's also possible that things get rejected by the advisory board or the prioritization committee if it's not considered sufficient public health priority. You then may be invited to a full proposal, which gets sent for peer review. So there can be anything up to kind of 6 peer reviews of that. Then comes back to the funding panel, who can decide to reject or encourage a resubmission or straight fund. Doesn't happen that often. Most common is a fund with changes, and changes are agreed, and then a contract is issued. So it's quite a kind of number of steps in this process. And I think it's important to make sure that when you're writing an application, you're talking to the different bits of the application. So you need to kind of make sure that you're making it clear why it's a public health priority in the kind of outline of stage 1 application, and then moving forward to the kind of full proposal, really focusing on the detailed science and the scientific review. So is the research question within remit? Is there an intervention? These are the key things we'll be looking at. Are the intervention costs funded? Is it delivered outside the NHS? Does it meet the commissioning brief if it's a commissioned call? And I think the key thing here is, if you have any questions, contact the NetCC staff, and they are really helpful, and they will be able to either answer your question or refer you on to somebody that can answer your question. It's really important to engage with the program team. I can tell you that they're all absolutely lovely, and they are incredibly helpful. So, if you're unsure about something, just send them an email and ask your question, and I'm sure that they will be very helpful to you. We're also kind of checking on, is there a need for research? So what's the public health need? Is this something that actually needs evidence to it? Sometimes we get applications that come in and, the question is, well, why do we need more evidence on this? We already know this. And sometimes that's because there isn't a need for more evidence, or it's just that the applicants haven't really justified it and made it particularly clear. A key focus of this scheme is kind of reducing inequalities. We know that a lot of public health interventions actually widen inequalities, so we really need to make sure that that doesn't happen. We want to find out if the findings can be generalizable and translatable, and kind of, is there a clear research question that's been articulated? So we're also keen on whether or not the research question is feasible. So this is that kind of tricky balance where you need to think about, you need to be ambitious but realistic. So, I realize that's all, as somebody who applies for grants, that can be a tricky space to navigate. So it needs to be possible, but not too much. The methods need to be appropriate. A key challenge is recruitment methods and assumptions. Often applicants kind of come up with assumptions that are perhaps overly ambitious in terms of recruitment. We need to make sure that they're not. Make sure that your sample sizes are clear and justified. So, what is it that you're trying to detect? Do you have enough people? How have you come up with that sample size? Do you have the right team? So, have you got a health economist? Have you got a qualitative researcher if you need them for your application? Have you got a statistician? Have you engaged PPI members? You really need to be engaging them in the design of your application to make sure that you are doing research that meets the needs of the key stakeholders. This next slide is really kind of the basic stuff about writing an application. You need to make it clear and easy to read, because you've got to remember that when we're reviewing them on the panel, we've got a lot of these to get to. They're very long documents. Often we're doing it in the evenings or at the weekends around our day job. So make sure that the application is clear, it's simple to read, it's logical, use headings. White space is actually quite helpful. So sometimes people just completely fill the page with text and no gaps between paragraphs. That does make it harder to read. You know, can you use a diagram to articulate something to demonstrate your study design or your recruitment method? And make sure you've got all the kind of key sections. So your participants, your intervention, your control, your setting, your outcomes, your sample size, and your analysis. And these are all, there's lots of guidance on these on the NIHR website that kind of maps out what we would expect in the project description. It's really important to kind of follow that, but present it in a clear way and not overclutter your design. Make sure if you're doing a feasibility and pilot study, you've articulated why. As I've said before, we don't do that early discovery new interventions, but where you're kind of adapting stuff, you need to make it clear. If you're doing a pilot or a feasibility study and you're suggesting that that will be used to progress to a full trial, what's your progression criteria? How many people do you need to recruit? What would you expect in terms of response rates? How would you make a decision whether or not to proceed to a full trial? So there's some helpful stuff about stop-go criteria and traffic light systems that's out there, and we'd encourage you to think about those. If you're going for a full trial and you have pilot data and you have evidence to justify what you're proposing, please present it and don't just refer us to a paper. Actually put it in the application. We want to read the application. So if something's critical in terms of making it clear why the study is important, make sure it's included in the application and not just referring us to a reference. You know, every application has a good team. So you really need to think about who your team is. If you're doing a clinical trial, contact a clinical trial team. Otherwise, contact an RDS service. I think the key message here, and I'm sure my RDS colleagues would agree, do it from the beginning. Not, I've come up with my design, I've made all my decisions, and I'd like you to just check this box. Because actually, the reason for engaging these teams is they have expertise. They can help you come up with a better design. They can help you kind of work through all the application. So I think it's about contacting them early. We do comment on the track record and experience of the team, but that doesn't mean that we're just looking for, you know, very senior professors who have no capacity to deliver the project. We're looking for a team that's got experience, but where the team members actually have the capacity to deliver the project. Make sure you've got your stats support. Make sure if you're doing health economics and qualitative researchers that you have named people with that expertise. Think about who your steering group would be in your patient advisory, and if appropriately, talk to your clinical research network and get their support. Key question is, how much can I ask for? There's no maximum limit on the duration and costs, but kind of, you know, you've got to be realistic. And I think a key thing we judge against is value for money. So you need to make sure that the costs you're asking for are reasonable for what you're proposing to do. And I think it's important to make it clear that they need to be both reasonable in terms of not being too high, but equally, if you come in with a very, very low budget, it probably suggests you haven't really thought about, you know, all of the key things that need to be considered. And we want to kind of think about how those costs are justified in terms of relation to the disease and the prevalence of that in the population, what it is you're trying to present, and how it might, you know, compare with other study designs. It's critical that you have patient and public involvement. We want representation during the project, during the delivery, and the management of the research project. And this is a bit that's often forgotten about. You need representation and input on your management groups. And we will be looking for that when we're judging the application. Often, applications will come in and say, you know, we will produce these papers and we'll present at these conferences. But we'd like you to go a bit further. Think about how you can imaginatively disseminate this. How will you translate your findings into policy? How are you going to share it with policymakers? How are you going to make that difference? And you need to kind of cost that in. And we see all sorts of different ideas, and we'd like you to think about different concepts, different methods of sharing findings, so that you come up with the method that's most appropriate for your project. It doesn't have to, just be, I'm going to write a paper and I'm going to go to a conference. We want more. We want you to come up with something that's a bit more interesting and innovative. The feedback you get from the funding committee, so you'll get feedback after a stage 1 or outline bid, and then after a full bid. It's intended to be helpful. We nobody likes receiving criticism, but the feedback is intended to help you come up with the best bid that you can. And we really want you to respond to that feedback from an outline bid when moving forward to a full bid. And that is one of the things that we are asked as funding panel members, is how have applicants responded to feedback? I mean, it's a real mix of people on the committee. We've got behavioral scientists, economists, epidemiologists, lay members, policy experts, public health people, psychologists, sociologists, statisticians, and kind of we have the expertise to assess pretty much everything that comes in. And if we don't, then we will have picked that up in the external reviewer comments. So if there's some specialist knowledge, we would go and seek that from the external peer reviewers. Common pitfalls, I mean, these apply to most grant applications. The application can't answer the research question. There's a fundamental flaw. It's not really enough detail on why it's a public health issue, not enough detail on what's being evaluated, lack of developmental work. People haven't paid attention to the feedback. Everything's been rebutted. I mean, you can rebut some points if you think the panel is wrong, but generally we would at least encourage you to consider the feedback. And then the costings are unrealistic. And I think it's important to flag that when we say they're unrealistic, sometimes this can be heavy overcosting and sometimes it can be undercosting. And we really want to make sure that you've got a team who's committed to the project, who's going to give it the right amount of time and provide value for money. And if the submission is badly written and hard to read, it's very hard to then justify why, kind of to assess it in a coherent way. I suspect many people on this call have student teaching assessments, and it's pretty much the same. You can't really grade it unless you can actually read it in a coherent manner. And remember that everybody reading it is both incredibly busy and time pressured, but also some of the panel members, it will be outside their specific expertise. So you have to kind of make sure that you can describe it to somebody with slightly less expertise than you. We will pick up inconsistent accounts of what you're proposing to do. So classic is, differences in sample size calculations. In one section it talks about X, and then a page later it's talking about Y. Missing major work, so make sure you've done a search of recent work, and also looking at what's been funded by PHR and other bits of NIHR. Is there an ongoing study that would address your question? So please check that, because if we've already got an ongoing study, then we may not be that interested in funding another one. Gaps in the expertise of the research team, that's something that you can think about. PPI, and then the lack of qualitative and particularly economic analysis often comes up.